This is Selma Schimmel in Washington, D.C. at the Community Cancer Care Advocacy Day Forum, where we are now going to bring you our Voice for Life feature. I'm happy to introduce you to oncology nurse Joan Digirolamo and your good friend and colleague, Ruth Lander, who is a practice administrator at the same office where you work, Joan, which is Columbus Oncology and Hematology Associates. And I understand that you both met 25 years ago, and you were the first one to go through breast cancer in the 90s.
Yes, 91.
And then you followed in
2007.
And it looks like you've taken your show on the road using your voices, and that's really what I want to talk about. Tell our viewers how you, as professionals within the oncology setting, have taken your voice beyond the practice out in the community to help others.
We go to Washington at least once a year or more, and we also advocate by writing letters to our elected officials. After having cancer and seeing the general feel in the country, there is no money, and sometimes you get the feeling that cancer patients could be overlooked because of the cost. And we don't want that to happen. Every patient is precious and deserves a chance.
Ruth, let me ask you, as a practice administrator, what changed for you prior to cancer, post-cancer?
I have more compassion and empathy now. I walk through the chemotherapy treatment room at least once a day, sometimes multiple times, and I look at each face that's getting cancer and the person or two that are with them, and try to just extend a little love and show my care for them just by walking through, smiling. Sometimes I talk to them because it's a scary thing to go through alone, and I just want them to know that we're rooting for them and that we care for them.
The way you approach your job now, how different is it from how it used to be?
I've gotten a lot softer. Some of that could be by age. But some of that is having gone through a life-threatening disease.
And what about you, Joan? What has changed for you from prior to your diagnosis and after your diagnosis, and how are you using your voice differently?
Since I am such a success story, I know that it is possible to survive cancer, so I feel that everybody should be given the same chance, and just because the drugs are different now and treatments are different, I just want to do as much as I can to make sure that they can get the treatment that they need.
Do you share with any of your patients that you're also a survivor?
I'm not directly working with the patients now as the clinical manager. Now, when I was diagnosed with breast cancer in 1991, my patients very well knew, and they were trying to take care of me just as much as I was taking care of them, and it was a good relationship. I mean, to see their empathy toward me, it was like, wow, you do this, you do that, this works for me. It was good.
We did have that one patient within the last few years. She was scared to death. That's the only thing I can describe. And she just wanted to talk. And finally I said, why don't you come and we're going to have a meeting with the clinical manager and myself. And during that meeting, which was very unusual, we had never done this before, we shared that we were both survivors and for a long term, and she calmed down because she was afraid it was a total death sentence. And she realized.
So you became a point for inspiration.
It was amazing to see the difference.
What does your job entail now?
Right now I manage 31 of a clinical staff, or 33, I can't remember exactly now, 4 departments, within the office. I work very closely with the billing department or the financial counselors to get the chemotherapy approved and, pre-certed.
And you fight hard for the patients to get those approved. You should hear her talking to the insurance companies sometimes. She fights for the patients.
What advice can you give to viewers who may not have such a passionate team to support them through all of the hurdles that patients so often have to go through with their insurance carriers for reimbursement?
I would advise them to be very, very aware of their insurance coverage and to be their own advocate. I mean, you know, I know they're sick, but they have a family member. I'm not saying that they should do it because I don't want to do it, but I think they can add to the voices. They can pick up the phone and say, my mother needs this treatment. It has been recommended, you know, and I think that they should contact the insurance carriers just as much as we do.
What do you feel are some of the things that could happen now to overcome some of the obstacles and dilemmas that we face within community-based practices, dealing with economics and shortage of staff, shortage of doctors, shortage of nurses, difficulty with reimbursement for some of the drugs that you spoke of that used to be so simple to obtain?
Well, I think for one thing, managed care carriers should really look at their numbers. What are they paying in a community setting versus a facility setting for care for a patient? And instead of trying to get lower reimbursements for us when we recontract, or maybe a 1% or 2% raise, work with us to pay us appropriately, because we are a lot more efficient and a lot less expensive. It would help the whole, it would help everybody. It would help patients have care closer to where they live. It would take a lot of pressure off of community offices. It would be a wonderful thing if that happened. And I see glimpses of it, but not the way it should be yet.
I think they could look at their data. I know that there's data out there that they check every office, every physician, how they treat and what they do. And I think they can know that we treat according to NCCN guidelines, and I think that they can stop some of this prior authorization and all these things that I feel are making you do to try to discourage you from, giving certain drugs. I mean, the NCCN guidelines are out there. The doctors use them. They know when they pay for the drug with the diagnosis that we are.
We spoke with someone affiliated with ONS a bit ago, the issue of the oncology nursing shortage, and how would you use your voice now to speak out to some of our students that are thinking actively about where their careers could go in the future?
I would encourage them, to know that it's very rewarding. There's lots of illnesses out there that are not curable, so that's the thing I get most, that it's so depressing and you make people sick and things like that, and you do have your rewards. It is very rewarding and the patients are very appreciative.
I would never change specialties, because the patients, even if they come in, I will say a hardened professional sometime, as they go through treatment and the years and time goes by, they become lovely people. I became a nicer person with cancer. I have encouraged nurses to go into oncology. I helped set up a scholarship through ONS for Central Ohio. For nurses to get some added money so they could become oncology nurses. It is very, very rewarding. You have real patients, they're real people. You get them at a wonderful time. And I just don't think you can find that in another specialty.
The thought that I would like just to leave you with is to know that you are advocates, and you are using your voice, and part of how you use your voice now is a direct response to and a gift that cancer imparted to you to be able to do this on behalf of others. So I thank you for that.
Well, thank you.
Joan Digirolamo, oncology nurse and survivor, and Ruth Lander, practice administrator, also a survivor at Columbus Oncology and Hematology Associates.